Hello everyone. Welcome to Confidence Dental Podcast. Every fortnight we try to bring topics which is of relevance to dentistry. So today let me start with a astonishing figure. We have more than 3.74 lakh registered dentists in India with more than 65,000 dental clinics. These range from a one chair clinic to a 40 chair practice, and also apart from this we have more than 318 dental colleges and dental hospitals. The most neglected part of these practices is the regulatory and compliances that go along with having a practice. To speak on these regulatory concerns, today we have an expert with us today, Mr. Ananthu. For more than quarter of a century, he's been associated with this kind of regulatory practices. Welcome to our podcast, Mr. Ananthu.
First of all, let me take this opportunity in thanking Confident Dental for inviting me for the podcast and covering the topic related to regulatory and compliances, especially for the dental clinics. So to say more about me is that myself, Ananthu. So I've been part of this dental industry from 25 years. So from 12 years, we are covering only related to regulatory and compliances for whole of healthcare. Maybe a small clinic to hospital, to the diagnostic, to the pharmacy, to related to the Ayurveda, anything you do, we handle every related to compliances related to dentistry. So today the topic we'll covering only related to the dentistry or a dental clinic which comes under regulatory and compliances for the state Karnataka.
Let's begin. When we usually talk about compliance in dentistry, we refer to how the patients will compliance to our treatment or how they comply to the medications that we prescribe. But today we are here for a different kind of compliance. Regulatory compliance. So Mr. Ananthu, what exactly is this compliance? Can you share your views?
So regulatory and compliances, put it in a simple term, is the rules and regulation laid down by the different authorities of a state. So any dental clinic, before they could start their practice, they should ensure that all the regulatory or authority license are being taken and they start a clinic actually.
You mean to say that before the clinic has started, now that many clinics are already operating with or without these regulations, so can they still go and get their clinic regulated?
No, the government has given an option for the already registered, already running clinic can register the clinic and make the clinic of a legally compliant with the state authorities.
Sir, it's a very valid point that you told. The government has given an option for the existing or running practices to still go ahead and comply with these regulations. What happens if a clinic fails to regulate or comply with these directions?
Okay, so failure to register a clinic with the state authority may lead to a legal hassle from the government. Any government department may come in and ask for the closure of the clinic. They may issue a notice. In spite of the notice, if they don't try to regulate the clinic, the authority have an opportunity to close the clinic. Till the clinic obtains a license, they can't run the clinic. And it is a very long process over there because it has to go to the DC code, get a permission from the DC, then only they can start their practice. So this will make the whole concept of you opening clinic getting into a different way. Actually.
Wow, that's an eye-opener. So the people who are listening here, please make sure you comply with the regulations. Otherwise, it can lead to closure of the clinics apart from the penalties, right? So moving
recently, we have seen many of the clinics have been closed. Recently, last week, 52 clinics from different sector, not in dentally, they have been closed and a fine up to 10 lakh have been put on them. And they can't open till they open. It was in the news also. That's the reason I'm saying you, at least a dentistry, which is the major factor because they involve a surgery there. So whereas the medical legal compliances are a little bit more in the dentistry over there. So complying with the state authority is very, very important actually.
So it's not an option, but it's a must.
Mandatory actually.
Mr. Ananthu, what are the major licenses that every clinic is expected to have to run a dental establishment? And who are the regulatory bodies for these licenses?
So, dental clinic is very simple. You need to have only two licenses. One is from the Pollution Control Board, other one is the KPME. The Pollution Control Board means majorly related to the biomedical waste which is generated in a clinic. So with that biomedical waste authorization, you need to take a pollution control certificate. Other one is the Karnataka Private Medical Establishment, which we call it as a KPME, which is issued by the health department. So which covers majorly all the licenses to run a clinic more effectively.
Mr. Ananthu, you spoke about KPME or Karnataka Private Medical Establishment Act. Our viewers are panning all over the country. So I would like to know whether these kind of acts exist in other states as well.
So this KPME, whatever you call Karnataka Private Medical Establishment, is laid down from the Clinical Act made by the central government. So each state has their own sort of rules and regulation and an authority to over there. In Karnataka, it is KPME, and each state has a different authorities. Some states have implemented, some states have not done extensively over there. But if you take up the South India, Mumbai, Pune, Gujarat, and all, they have extensively have this authority to cover the clinical act for their state actually.
So basically, it's a centralized act, but followed by various states. Some states are following it seriously. Some states are yet to implement it. But stitching time saves 9. So better to have those things ready in your clinics in whichever part of the country you are. Right. So moving forward, most clinics or almost all of the clinics now incorporate at least an intraoral periapical radiograph or a radiographic machine. Some clinics even have CBCTs and OPGs in their clinic. So what are the regulatory compliances when it comes to radiation safety?
See, any instrument which generates a radiation has to be covered under ARB, which is an atomic body over there, which is covered by the central government actually. So if you have an X-ray, which you have a material which radiation is there, then you need to take a ARB license from that authority over there. So nowadays, before you buy a machine, especially OPG or the CBCT, registration with the ARB set is compulsory. Then only the product is being delivered. But the clinics who have this IOPA can register now and take a license. The license is given for 10 years over there, and this is to ensure that radiation which comes out of the X-ray are safe. Because this radiation affects more of a doctor rather than the patient, because they are in the clinic for a longer time, and the leakage of radiation will have a greater effect on their body actually. So ensuring that ARB certificate is taken, it is for own safety rather than from the regulatory point of view.
Thank you, sir. For the uninitiated, AERB refers to Atomic Energy Regulatory Board, which is a central government enterprise. So we have to take the licenses from them. And as Mr. Ananthu rightly told, radiation safety refers to for the dentists who are sitting there in the clinic all the time as compared to the patients. So along with your patient safety, please make sure that you and your technical staff are safe too. Mr. Ananthu, as a dental establishment, they generate certain amount of biomedical waste. As we all know, this waste cannot be disposed of randomly or through civic authorities, and it has to be disposed of in a safe and secure manner. So can you throw some information to our audience about how this biomedical waste has to be tackled?
Taking care of the Bangalore, the whole of the Bangalore are divided into 5 regions over there. And the government has appointed some authorized distributor or whatever you call agency who will tackle your biomedical waste, dispose it in a more safer way. So at any cost, the biomedical waste can't be given to a civil agency or the local authority called BBMP and dispose it of this thing. You need to tie up with the proper agency who will dispose your biomedical in the more safer way. And nowadays the pollution control board has become very stringent. They are tracking each and every clinic where the biomedical waste has been disposed actually. A small syringe found in front of the clinic may lead to a fine up to ₹1,00,000 without giving an explanation. They just ask you to put a fine actually over there. Because you need to show the agency with whom you are tying up over there, you need to show whether you are maintaining a records of how much of waste has been given or the authorization taken from the pollution control board.
And what are the things the dentist should be aware of regarding to segregation of waste?
When you tie up with the biomedical waste, they give you a chart like color coding bins they'll give you. So you need to segregate based upon the color coding, based upon the generation, what you do it in a clinic. It is very simple to understand. The chart explain like syringes has to go in this thing, cotton has to go in this thing. So this biomedical waste usually takes the biomedical waste every 48 hours over there. So you need to just wrap it over there and keep it in the clinic over there. They come, take it over there, and they give you a slip saying that they have been taken care over there. So this goes on a monthly basis. And moreover, this biomedical waste is not a very costly. They charge somewhere in the range of 900 to 1000 rupees, that's all. So they come thrice a week over there. And I suggest that every dentist should at least make sure that biomedical waste been taken care, because you miss it out, you will get into a legal tangle which is very difficult to come out actually, because anyone can file a case saying that a neighbor, shop owner, or any civil authority sees that there's some sort of waste, biomedical waste found in front of your clinic. No, they can authority, and in government authorities will first they'll come for the biomedical waste if it's not been compliant actually.
So for all the young dentists out there, remember, biomedical waste segregation and disposing of through a licensed personnel is of paramount importance. Otherwise, you will lead to a lot of legal problems. And also make sure you train your support staff also in taking part in the segregation of waste. Because many a times the dentists will not be handling the waste themselves, but the support staff will. So educating them and training them is of very great importance. Now that we know that we have to segregate and dispose the waste in a planned manner, whom to contact, or how do we get in touch with this waste disposal companies?
As I told you, the whole of the Bangalore is divided into 5 to 6 regions. So each region has been given one agency to collect the biomedical waste, and they take care of the whole of that particular regions to dispose it in a proper way. So before a dental clinic is starting over there, at least you ensure the neighborhood clinics, like which agency is there in the area, and you can connect to those people and get the biomedical done. And the biomedical done can be done in a 2 to 3 days, that's all. So basically they require the rental agreement and your KSDC certificate. Once you give this thing, then the agency will make a contract for a 6 months or a year thing, and they'll ensure your biomedical waste has been taken and they dispose it in a more safer way.
A lot of our viewers are young dental students who are planning to open up a clinic in the future. Some of them are postgraduate students who will open their clinics in the near future. Or there are even some established dentists who are planning to open a second branch of their clinic. So now, how do you go about registering a dental clinic? Because we cannot open a clinic like a random trade establishment. There should be some registration process. So what are the things involved in this?
Sir, registering a dental clinic comes under a KPME. That's a Karnataka Private Medical Establishment over there. So the government has a dedicated website for the KPME. So wherein which every practitioner needs to go enter all the details about the clinic, what specialty they are doing, how much of patient they are taking, and what all the equipments they have, what sort of service they are giving to the dental clinic over there. So this gives the government a picture what is the practice you are running actually. Suppose you are a dentist over there, so dental clinic doesn't have much of a specialization inside the dentistry over there, so it will be considered as a dental clinic actually. So in that you need to show that you have a proper rental agreement, you are a doctor, so what sort of specialization, and you have an authorization taken from the pollution control board. All needs to be uploaded over there. So once it's uploaded, you need to pay the government fees over there. So once everything is submitted over there, a local officer has been deputed to take care of your licenses over there. He comes visit the clinic. He'll see whether the clinic is as per the law made by the government over there. Also rules and regulations has been followed. Once this is done, the license are given. The license is valid for 5 years actually. After 5 years, you can auto renew it on your own.
Now that we have decided to register our clinic, what are the rules and regulations that we need to comply for registering this clinic?
So KPME rules and regulations, especially the dental clinic, majorly caters to the dimension of the clinic. So you can't have a smaller dimension of a waiting area, like 5 by 5 I'll open a clinic, which it leads to a problem for the patient. So you need to have a specific dimension set by the government. You can't put a chair in a smaller area wherein which it will be very congested for the patient over there. So the government has told that minimum dimension has to be put, minimum waiting area has to be there, and how do you sterilize over there, how do you dispose the biomedical waste, whether if you have an inbuilt lab over there, what all the thing needs to be taken. If you're tying with the lab over there, you need to ensure that the lab is also registered with the KPME, or they follow the protocol laid down by the government over there. And apart from this, most important thing from the patient safety or from the patient point of view, every clinic needs to display their KSDC certificate in the notice board. And the patient should know what is the rate list charged by the doctor. especially in the dentistry, since the charges differ based upon the procedure, at least the minimum of consultation fees and X-ray fees, which will be common for any patient, needs to be displayed. And the patient needs to know like what will be the charge for RCT over there. So he should be given a range. Okay, this is the how much over there, and he should be explained over there. So the patient should be knowing, okay, this much charges will be, I'll be going for this procedure actually. You can't say that, okay, after the procedure I'll let you know, it's not acceptable as per the KPME. It has to be there, the price list has to be displayed.
But can the dentist have the prerogative of fixing the price list for the dentist?
See, as of now, the government has not put a price band for a particular procedure or something over there, but they are only ensuring is that make sure your patient know what is the pricing actually. Suppose I come with the mindset of 3,000 or 5,000 for RCT, and suddenly he comes out to 10,000, which is surprising after the procedure, so which will lead to a issue to the patient also, for the doctor also. So that's sort of this thing over there. And apart from this, KPME pollution board needs to be displayed over there, and what sort of agency, biomedical waste, that also if you're displayed, if you have a list of consultant whom you're taking care or who's taking care of the procedure, if all their procedures are the process have been done over there, it will be more easier actually.
So you need to have a list of consultants and the list of price list for the kind of treatments offered. Yeah, Mr. Ananthu, during our early part of the interview, you mentioned that an inspector will come to visit the clinic and will have an inspection of the clinics. So, what aspects should the clinic be ready in to face such an inspection?
See, as of now, the government has appointed about 8 to 10 KPME officer who can randomly go to any clinic to check whether the KPM is registered or not. As I told you, if the KPM is not registered, they issue a notice to register within a matter of weeks' time. If still they don't comply, then they have an option to close the clinic till you have your KPME license done. So once you have applied for the KPME license, so when they come for the inspection, they call you before coming over there. They make sure that you are available. Once they come over there, they ensure they see all the documents, especially the biomedical waste, pollution. So whether you're displaying, as I told you, displaying of the KSDC, rate list has been followed. How are you disposing your biomedical waste? You have a color coded bins. You have a minimum area for a patient to sit or operatory area over there. And I feel it is very simple thing. And nowadays the dental clinic have wider infrastructure compared to what government has laid out. And more, I don't feel the compliances issue related to inspection will have a matter to the dental clinic. So it can easily go through over there, but ensure that displaying part is not done and the biomedical pass is not done recently, because many are not aware of this particular thing. If these two things are taken care, I don't think so KPM will have any problem. But registering of the KPME before opening the clinic is my request to do to all the dental clinics actually.
That's nice to know, sir. Sir, as you all know, we practice in a metropolitan city like Bangalore, where price is at a premium depending upon square feet. So you mentioned something about minimum requirement of floor area or operatory area. Can you just throw some light about it?
See, not to get into the full area over there, the government has specified the waiting area has to be 10 by 5.
Okay.
So that at least when a patient, at least 3-4 patients comes, they should sit comfortably. And the working area, especially in the dental clinic, has to be 10 by 10. So that when a chair is fully inclined or something over there, then you can easily operate. So 10 by 10 for a working area and 10 by 5 for the waiting area should be sufficient to comply with the KPME law.
Mr. Ananthu, we discussed a lot about must-haves for the clinic. So there are some practitioners who are looking to improve upon that. So some things like accreditation is good to have. So can you tell us more about NABH accreditation?
So for NABH is only accreditation which has been now been done by the dental clinic. So this is an option, this is not mandatory over there. So NABH will ensure the quality of a clinic, a trust factor over there, and you can market your clinic in a much better way, because NABH accredited clinic has more value. And if you are going for a tourism international patient over there, NABH certificate will make a lot of difference actually. So as of now, the insurance sector has not still come to the dental industry over there, but some major insurance who are tied up with the corporates have been providing a cashless treatment for the dental treatment also. So if you have an NABH, this will help you in getting a cashless treatment in your clinic actually. So I can say NABH gives you a brand value.
So for all those dentists who are looking to invite international patients as part of your dental tourism package, NABH goes a long way in establishing your brand. Karnataka in general and Bangalore in particular has been the cradle of dental education, A lot of dentists who are trained here have been practicing all over the country. Similarly, Bangalore is a melting pot for people from all over the country, and there are many dentists who have done their graduation, post graduation from other states who are practicing. So, is there any requirement regarding registration of those dentists in Karnataka?
Sir, I'll suggest that suppose a doctor from any other states plan to practice in Karnataka or Bangalore, ideally they should transfer their registration to the Karnataka Council. Okay, so if you're planning to settle here for a longer term, then it's better you transfer your certification to the Karnataka Dental Council actually. And the process is very simple. Wherever you have done a dental, education over there, try to take a NOC from that particular state, give it this NOC to the DCI, and DCI will give you one more letter that you can transfer it across. Once you give this letter to the Karnataka State Dental Council, your registration is done in a matter of 1 hour or 2 hours. And the Karnataka Dental Council in Karnataka is very simple over there and more efficient over there. You get the whole thing can be completed in one day actually.
Great to know that. These issues are of very great importance when you land in problem.
Yeah.
So, to avoid these situations, and rules keep changing day by day, or sometimes we will not be aware of the changing rules. So, please get in touch with the regulatory bodies for the latest rules that is in the use or which is being followed to stay safe. So, Mr. Ananthu, we have spoken a lot about the regulations, compliances, must have, good to have, all these things. Suppose I am a dentist. I am looking forward to start a clinic tomorrow. So, what are the things that I need to be prepared with?
Okay, so this is the right thing to stay over there. See, first thing is that suppose you're planning to start a clinic in Bangalore. First thing what you need to do is that you'll see a place over there. Ensure that you start with a rental agreement. See, the rental agreement, clinic name in the rental agreement is not mandatory. You can mention it as a dental clinic over there. Your name has to be as per the Aadhaar over there. And you can mention your address wherever you're staying over there. But the clinic address, ensure that it has per the postal address. Don't take the survey number, kata number or whatever is there as per the sale deed or something. Make sure that you have a postal address over there, because once you register in a rental agreement, the same address goes on for all the license over there. And this license are for the permanent. So I forgot to mention over there. So Pollution Control Board is for the permanent one-time registration. You don't need to renew it across over there. And KPME is for the 5 years and it is auto renewal over there. So coming back to the rental agreement, make sure that your name is properly mentioned as per the Aadhaar. Rental agreement has the address of the particular clinic as per the postal address over there. Once you make a rental agreement, then you can call up the biomedical people who are nearby or authorized in your area, give the rental agreement, give your registration. If you're done from the other regions also, doesn't make a difference, because you can register with the biomedical ways from the other state also. Later on you can change it. So once you give these two agreement on the KSDC to them, they'll give you a biomedical agreement. So once the biomedical is ready and your 30 days before you start your clinic, make sure you start your registration process over there. Because by the time you open a clinic, you will have an acknowledgement copy of the KPME. So this is legally safe and you can practice without any legal hassles. Any officer comes and say you don't have a license, you can show the acknowledgement copy. So once you have a biomedical agreement over there, you can apply for the pollution certificate. Pollution certificate is free of cost. You can apply online and submit your KSDC rental agreement and number of patients number of waste you produce, everything has to be filled over there. And from the matter of 15 to 30 days, you get a pollution certificate. Once your pollution certificate is ready, you can register with the KPME, upload all the documents over there, and you can submit paying the government fees over there. Once you submit the government fees, the inspection happens based upon the convenience of the officer and based upon the location, what are this thing, they call you before coming over there. So if you follow these procedure, then your clinic is legally compliant and you will not get into any sort of a legal hassle over there. So apart from this, it can't be more simplified over there, because registration is mandatory. That's what I feel, sir.
Oh, that's a lot of information. So for all the budding dentists who are planning to open a clinic, along with your materials and equipments, there are a whole lot of legal compliances that you need to look into, that too 30 days in advance before you start a clinic. If you think it's a bit complicated, you can always contact Mr. Ananthu. His services will be available for you. The link for his communication and contact of Mr. Ananthu will be mentioned below in the link. So please avail his services. Thank you, Mr. Ananthu,
Thank you.
for sharing this wonderful information and the grey area where most of the dentists do not comply and taking time out for this. Thank you, sir.
Thank you, sir. See, I would like to thank Confident Intel for giving me an opportunity to speak about the regulatory and compliances in this podcast actually. As I told you, this is the most neglected part in the dentistry over there. But a simple process followed by the dentistry can make a lot of difference to their own practice and generally for the whole of the regulatory bodies also actually.
Thank you, sir. And for all the viewers out there, stay tuned, subscribe and like Confident Dental's podcast for more such informative talks on various industries connected to dentistry. Thank you.